Hi, my name is Debbie. I am a fitness instructor. I'm a level 3 pre and postnatal fitness specialist, and I'm also a qualified personal trainer. I run Mama Fit, which is a company that helps mums and ladies get back into fitness safely after having a little one, and also helps them progress from pregnancy through motherhood and to beyond. So when they're postnatally recovered, I also offer classes then. So today I want to talk a little bit about the pelvic floor and how to correctly recruit and work your pelvic floor muscles. Now we hear the terms kegels bandied around a lot, and it's basically just the way that we call doing our pelvic floor exercises from the person who actually created them, Dr. Kegel. So when we talk about Kegel exercises, what we're talking about is finding those pelvic floor muscles that are situated like a trampoline at the bottom of your pelvis and contracting them, lifting them up in a squeeze type motion and then gently relaxing them. That's all a Kegel exercise is. I'm going to show you with my pelvis model where the pelvic floor is, which will hopefully help you visualize where your pelvic floor is a little bit more and help you with that connection to that contraction. So here is my anatomical pelvis, and your pelvic floor is situated, as you can see, all the way along the bottom. It comes from one hip bone to the other, it comes right the way up to the pubic bone and then attaches at the back to the coccyx. So you've got a large diamond shaped pelvic floor muscle, and as you can see as well, there's absolutely nothing else, there's no bone, there's no ligaments holding the bottom of that pelvic floor muscle in. So when we think about the functions and the importance of that pelvic floor, not only for supporting your pelvic floor organs, but also supporting your baby as it grows, it does have a pretty big job to do. So it is important that we work the muscle just like we work any other muscle in our body. So the all important question is, how do we do pelvic floor exercises? Well, research has shown that the best way of actually locating the pelvic floor muscle and doing the correct type of lift is by focusing on squeezing from the back passage first, so around the back and around the anus, trying to focus on squeezing together and then lifting up and around and into the vaginal canal. One of the easiest ways of doing this exercise is by trying to visualize that you're holding in wind. Please don't mistake it with squeezing your bum cheeks. You don't want that physical contraction of your glutes as well. You simply want the pelvic floor to make that squeeze. So visualize starting from the back. Another really great visualization technique is imagining that there is a zip on the back and you want to slowly zip it up. So we want to squeeze down and around. We want to close that zip from the back all the way up and around to the front. And my last and favourite one is thinking about a blueberry, and that we're squeezing down, we're picking up that blueberry and we're bringing it up, okay? Imagine one of those big grabber machines, but instead of picking up a teddy, we're trying to pick up a small blueberry. Okay, so I said how we do them. So now we need to practice, but I'm also going to talk about the different types of Kegel exercises. So we have a long hold and we have a short hold. And they're just as important as each other, because not only do we want to work on your fast twitch fibers, which are when we're doing the short holds, but we also want to work on your slow twitch fibers as well. Your slow twitch fibers are going to be the fibers that are used throughout the day and for generally holding in your waste products and keeping that integrity in the muscle, whereas your fast twitch fibers and doing your short holds are going to be the ones that are activated when we have a sudden rush of pressure. So with coughs and sneezes, so when we have that sudden rush of intra-abdominal pressure, we then need to activate those fast twitch fibers to hold on and again to stop us from leaking. So let's do our slow twitch fiber muscle activation, so our short holds together. So I really want you to visualize. Now, one thing I will say is if you do have not a great connection with your pelvic floor, or there is already weakness there and you're aware of it, it's sometimes easier to do this lying down on the floor because it means we're not working against gravity. You can do it lying down, you can do it sitting down, and you can also do it standing up. Standing up being the hardest, and what you should aim to progress to in the future when you've been practicing these for a while. So let's visualize those techniques we talked about. We're going to close that zip and we're going to squeeze from the back passage first. So we're going to hold for 2 seconds and then we're going to gently release the pelvic floor. And it's really important that you allow that relax to happen, because what we don't want to do is cause a hypertonic dysfunction, which is where your pelvic floor gets overly tight. And this might be for numerous reasons, but you do tend to find that ladies with anxiety, and quite stressed women, also ladies who suffer with polycystic ovaries, and potentially people who may have been abused in the past, are ladies who sometimes suffer with an overly tight pelvic floor. So they're very, very tight and they hold on to it. So the relax is just as important as the contraction, especially in the cases of those ladies. Okay, so what we're going to do is we're going to breathe in, and as we breathe in, we're going to fill our belly with air, and we're going to do some diaphragmatic breathing. So we're going to breathe in, fill our belly with air, and you can see my body expanding, my belly expand as I do that. And then as I breathe out, I'm going to bring that tummy in gently, and I'm going to squeeze up and around. I'm going to work with my diaphragm, and I'm going to hold, and then I'm going to gently relax. So I'm going to take that breath in again, fill my belly with air, and then as I breathe out and my diaphragm comes up, so does my pelvic floor. So we're working with that motion, the natural motion of your body, and then you're going to gently allow the relax to happen. So breathe in, breathe out, we're going to squeeze up and gently relax. Breathe in, breathe out, squeeze up and gently relax. Breathe in, breathe out, pull up and squeeze and relax. Breathe in, breathe out and relax. Breathe in, breathe out, pull up and squeeze and gently relax. Breathe in, breathe out, pull up and squeeze and gently relax. 2 more. Breathe in, breathe out, pull up and squeeze and relax, and breathe in, breathe out, pull up and squeeze and gently relax. Okay, so those are our 10 short holds. It's really important, like I said, that we do a little bit of both. So we recommend doing 10 short holds in one sitting, and then 10 long holds. Your long hold should be anything up to 10 seconds, with the aim to get into between 10 and 15 seconds for this long hold. So we're going to do a little test now, and we're going to see how strong your pelvic floor is. If you do get to the point where your pelvic floor seems like it needs to relax, and you can't hold it on for any longer, please allow your pelvic floor to gently release. Don't allow the pelvic floor to drop or to release itself, because we don't want it to get to the point of exhaustion. So from 1 to 10 seconds, we're going to hold this as long as we can. Are you ready? So visualize that technique, whichever one works for you. So we're going to breathe in and fill our belly with air, and then we're going to breathe out and we're going to pull up and we're going to hold 2, 3, 4, 5, 6, 7, 8, 9, 10, and we're going to gently relax, and you should really feel that relax. So that's your long hold. If your long hold for today was only 3 seconds, then just keep practicing that long hold. 10 long holds, just like that. I'm going to go through and I'm going to do 5 more long holds for you. So we've done a good amount of both short and long holds today. Okay, so breathe in, fill your belly with air. Breathe out, pull up and hold. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Breathe in. Breathe out, pull up and hold. 2, 3, 4, 5, 6, 7, 8, 9, 10. Breathe in. Breathe out, pull up and hold. 2, 3, 4, 5, 6, 7, 8, 9, and 10. Breathe in. Breathe out, pull up and hold. 2, 3, 4, 5, 6, 7, 8, 9, and 10. You will find by now you are getting quite exhausted, so if you don't last as long as before, that's absolutely fine. Last one. Breathe in. Breathe out, pull up and hold. 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. Okay, so that's how we do them. Hopefully those visualization techniques has helped you focus and understand a little bit more on where the Kegel exercise takes place, how to do it correctly, and hopefully you did feel, if you couldn't feel a lot of sensation when we were doing those, even with the visualization techniques, even if you couldn't feel anything at all, it is common. It isn't normal, so it is something that can be fixed and you can work on it. So as long as you're visualizing that connection and really trying to focus on lifting up, even if potentially at the moment you can't feel anything, you will be getting somewhere. One really quick way of checking to see if your pelvic floor is working and the muscles are contracting, even if you can't physically feel it whilst doing it, is doing the exercise and gently placing a finger on your perineum and seeing if you can physically feel that contraction. You can also take a finger and place it just inside the vagina and do the contraction again and see if you can feel that squeeze on your finger. Okay, and lastly, a couple of what not to do's. Please don't listen to anybody who tells you to do your pelvic floor exercises whilst you're on the toilet. So please don't do it if you're urinating. It will potentially cause a water infection. Make sure that if you do your pelvic floor exercises, I always recommend first thing in the morning when your pelvic floor is nice and rested, and don't overdo it as well. So this is why we say 10 short hold and 10 long hold, but really make sure that you are getting that relax in between. If you are struggling quite significantly with leakage or any other form of pelvic dysfunction, if you're feeling any heaviness down below, or if you think you may have hypertonic dysfunction because you feel that you're constantly tight, if you get pain during intercourse, hip or back pain quite continuously and find it quite a struggle to release products or to initiate the flow or go to the toilet, or you find that you're constipated quite regularly, then this may be pointing to a hypertonic or an overly tight pelvic floor. I would recommend, if you're struggling with any of these issues, that you go and see your GP and ask to get referred to a women's health physio who will be able to guide you with much more in-depth knowledge than I can in a video. Anyway, thank you for watching. I hope you've learned something. Good luck with doing those Kegel exercises. I promise you, you will not be doing them in vain. And if you do them regularly and if you make them part of your daily routine, you will thank me in years to come. Thank you for watching.